The first question is, I'm nearly finished my degree in nursing and I feel very alone. I am First Nations and from a rural area with little to no support. My band is in Saskatchewan and I'm in Ontario. I'm passionate about working on Indigenous health inequities and discussing social determinants of health. Yet I feel disconnected from culture and community. How can I make connections? How can I help be a bridge between Indigenous ways of knowing and Western ways of knowing? I feel a little lost. Oh, thank you so much for sharing. Yeah, that really touches my heart, and I can definitely relate to that feeling. When I first moved to Edmonton, which was a much bigger place than I've ever been before, and I moved alone for the first time, I did feel very, very alone for almost the first year. And so some of the things that I did to try to help branch out to community was things like go to the First Nations Center on campus, and they actually helped me with applying to medical schools, scholarships. They provided printer paper, which was also really necessary for me at the time. And I was able to, they would post different events that I was able to go to. And then through the University of Alberta, there was at the time called the Aboriginal Healthcare Careers Program. And so I met with a group of people in different humanities through that group, as well as the Indigenous Physicians Association of Canada. So I know that's very medical related, but I do believe that there are nursing equivalents. I know in BC there's an Indigenous Nursing Association, and I do believe there's a national component of that as well. Other things may be the Métis Nation in your area. There's different offices across the country, and so that may be a place. The Friendship Center Association is another place where you can connect with community. I'm kind of a person that even though I'm carrier, I've learned from people all over. So I had Cree elders that taught me how to smudge and taught me numerous stories and different things. I still learn from my kumus in Hawaii and listen to their stories and their teachings. And so I think we're in a position where we can really learn from each other and that we can try to link up and find community across the country. And I think it's such a great space to be able to learn from each other and to help each other, build each other up, which I think is a really powerful thing.
Yes, Terri, thank you as always for being way more articulate than I could ever be. And I guess the only analogous, empathetic way for me to answer the questions to say, when I went to do my undergraduate degree for the first time, I literally never ridden on public transit before. I felt so alone moving from a really small rural place to a large urban environment. And for me, it was vitally important to turn to the arts and culture environments, to turn to books, to turn to movies, to turn to anything that I could get my hands on where I could once again see what I understood to be my reality mirrored back to me. And I think as we search for ourselves and we desire community and desire connection, it is maybe picking up an author who's Indigenous or just seeking out an Indigenous movie maker or an Indigenous playwright or an Indigenous chef who's going to cook something that is reminiscent of something that we might know from our childhood. That finding those stories, finding those cultural expressions can be medicine. They allow us to connect into something that might be actively taken away from us. So I would encourage you as much as possible in the totally terrible, constrained time that is nursing education, when you are likely lonely and likely clearly feeling somewhat isolated, to find Indigenous voice in bookstores, in movie theaters, on Netflix, on cable TV, on the radio, on live streaming through the internet, wherever it is that you can find it. Let it tell you that you're not alone, and let it offer you incredible lessons about the amazingness that is you and your community, is what I would say.
Also, thank you, Lisa, for your comments. She referenced the Canadian Indigenous Nurses Association, and the Student Nurses Association has an Indigenous advocacy group. So thank you for that.
And Helena has shared Unreserved. I love Unreserved. It's a CBC program, and it's amazing. Like sometimes just listening to Unreserved it's Rosanna Deerchild, right? Yeah, Rosanna Deerchild is a force actually, and super, super worth listening to. So thanks, Helena, for that suggestion. We had another question. Could there be a repository for Indigenous contacts to assist with research? And I think that certainly just link into the National Collaborating Centre for Aboriginal Health. There are an amazing repository of Indigenous researchers, Indigenous stories, Indigenous scholarship that can be accessed. We can also try to put something together at the end of this, including all of the artists and theorists and scholars and activists that have been shared during this webinar.
Awesome, thank you. So the last question I see flagged is, I love this work, and as I'm immersed in a similar journey, how our traditional knowledge is medicine, I believe healthcare needs more humanities. My question is now surrounding the issue of who is burdened by this continued trauma on Indigenous people. I'm getting sensitive about so many of us Indigenous scholars having to share our burden so others can learn. How do we encourage non-Indigenous healthcare providers to take on this responsibility other than from the bodies of Indigenous people? So thank you for that question. Certainly in social activism, this is talked about a lot about why do essentially non-Indigenous people or white settlers or whatever term you'd like between either Indigenous or non-Indigenous, why the expectation is that Indigenous people essentially have to hold space for non-Indigenous people and make it very sensitive and culturally safe and all of that sort of thing. And I completely understand. I think for me, like often what I think of is that, and this is kind of more of a personal way I deal with it, is that I understand that there's so many times when I meet doctors and I get to know them and they're just such amazing, fabulous people. And I'm sure this is true for all healthcare professionals. People are really out there really wanting to do good and to provide good care. But sometimes they just don't know what they don't know. And it is an opportunity to be able to call people in. But I also have to be aware of myself. Where am I at the time? Do I have the capacity to call this person in at this time? And if I don't, then to release the guilt of not needing to always commit to that. And in particular, like calling people out, sometimes I find this one really hard. And when somebody, I feel like their intent is harmful and it is a time that, potentially I need to call them out, I do find it really hard to step into that because it's so exhausting. And so I would agree, if you're a non-Indigenous person out in the world and you see somebody who might say something racist or have a racist joke or that sort of thing, I would really try to encourage you, if you can, to start calling out those people, because in particular, I find that that's a particular drain for me. Definitely part of it is self-care, is that realizing that this is not our burden. It should be all of Canada's burden. And absolutely, I'm passionate about this work. And there's so many Indigenous people out there trying to call people in, doing the work, but it's not ours to carry alone. And so I think as we call people in, amazing allies like Sarah DeLeo and a plethora more, is having those conversations of how can we continue to call people, how can we continue to share the burden, and sometimes maybe referring them to different Indigenous scholars or different Indigenous allies.
I feel, it's Sarah here again, I feel in some ways saddened that Terri just had to do that work of saying exactly what she said, because I think it's incumbent, especially on non-Indigenous settler Canadians, and I'm going to parse that apart even more, because I think in Canada it's not a conversation anymore about just white settler Canadians and Indigenous people. Settler Canadians are deeply racialized in different ways, but let's be clear, and I can say this as the shiniest Dutch white human that you ever did come across, as my shiny picture does depict, particularly people who live with an extraordinary amount of privilege through whiteness and through settler colonial privilege. It should be our job as activists and as citizens and as concerned people to begin to take on the conversation of anti-Indigenous racism in this country. And I deeply believe, and this is why I'm so passionate about the arts and the humanities as a place to go, because it is not the place of Indigenous people to pour their guts and heart and soul into things to make white people feel better. White people can go to an existing plethora, libraries full of it, art galleries full of it, movie houses, playhouses, restaurants, things that are on the public record and doesn't require gutting real live people who have gone through enough as an Indigenous clinician, as an Indigenous nurse, as an Indigenous activist. I shouldn't be asking Indigenous people to give even more if I haven't gone above and beyond to access what is already on the public record and so generously offered through the arts and humanities. So you know best what is the place and role for you, but maybe be in touch with me and I'll buy 20 copies of Indigenous authors' books. And if somebody asks you to do that work and is doing it because they just can't be bothered to go and access what is already on the public record, you could hand them a book by my new favorite short story artist in the country, Nora Dunning, who's an Inuit artist and author, and just say, go read this. If you want to know something about contemporary Indigenous people, access a record that is already out there. Don't try to gut people whose stories are too valuable and whose time is a beautiful resource.
I also keep it in my office. I keep extra copies of The Inconvenient Indian, and sometimes I just hand this out.
To be honest. So good. Just hand it out.
And I would say, if you're interested in learning more about these topics and Indigenous people and you want to ask them questions, don't necessarily be scared to. Don't feel like you need to walk on eggshells. But do a check-in. It's always good in this world of #MeToo. Consent is such a wonderful concept and thing that we can all learn from. And so just doing the hallway thing where you just corner somebody in the hallway, just ask permission. You're like, you know what? I heard this thing, whether or not it's ceremony or Indigenous topic, and I thought maybe you would have some really interesting thoughts on it. Would now be an okay time or at some other time? And so I'd just say, if you're unsure, just ask permission before you ask the question. So I want to share one more story with you. And as I said, I've learned from elders now internationally and nationally. But so this story is from a Coast Salish elder. And I was told that it was shared the first time that they were invited to the BC legislature. And the elder shared that traditionally, hundreds of years ago, when they needed a new canoe to help gather food, to take them to their winter and summer camps, and oftentimes these canoes would last a lifetime, but when they needed a new one, they would go out in the forest and they would look for a cedar tree that would essentially call them in to let them know that the cedar tree was giving itself to be made into a canoe. And the cedar tree was so big that oftentimes the canoe can just be dug out from one cedar tree. And it would, like I said, last a lifetime and serve that family and community. But nowadays, when a canoe is needed, again, they go out into the forest in ceremony, but they need 2 cedar trees. And so they need to look for 2 cedar trees to give themselves, and so that they can be carved in the perfect fashion to come together so that there's no leaking and it can function well as a canoe. Can anybody guess what those 2 cedar trees are? They're Indigenous and non-Indigenous people. And so we really need to come together and work together to be able to travel, to journey together in a canoe that brings us into the future where all Canadians are healthy and educated and have equal opportunities, that nobody can sit out. We need to work together. And so I say, I am an Indigenous Western trained physician, but I don't walk in 2 worlds. I walk in one. And it's one where there's a tension there. But I know that we can do better. And I believe in each one of you and all of Canada to be able to build that bright future for all of us. So that when I ask a patient to go to the emergency room, they say, that's where our people go to heal. Thank you so much for joining us today. Snat Chalia.
Thank you. And I wish you could all be in the same room as Terri, because Terri, thank you very much. And thank you from the NCCAH. And thank you for, I think, so perfectly articulating the way that story and creative, beautiful thought and practice can come together, hopefully, to address the sorts of disparities that we have to address in this country. And thank you all from coast to coast to coast for joining the NCCAH in this webinar.
Have a great day, everyone.